Lagos Traffic Radio 96.1 FM. Let me see if I can pump this up. All right, it's time for us to sink our teeth into the conversation this morning on this very, very first leg. We're going to be talking about how to, give access or more or less provide support systems for the vulnerable in the society. So we're trying to improve access to quality healthcare through collaborative medical outreach in Lagos. And joining me on the phone line this morning, I have Honorable Lukman Oyewole Lawal, who is a special advisor on finance and budgets to the Speaker House of Representatives. Honorable Lukman Lawal, nice to have you join us. Good morning.
Good morning, Mr. Victor.
And how are you doing?
I'm happy to be here. Very well, very well. It's a bright, shining morning here in Abuja.
All right. Anyway, even though it's Abuja is where you are right now, but I know the big buzz is around Lagos, where some medical outreach will be hitting town next week. Talk to me. What's the whole idea behind this medical outreach?
Okay, so we have the consensus around the three legs of human capital development, being education, healthcare, and then enhancement of household income.
All right.
But we all also have the consensus that the two other legs of human capital development rest on one, which is the healthcare. Without healthcare, education will suffer. Without healthcare, enhancing household income would also suffer.
Right.
Because the human has to be well first. So it's a no-brainer to say healthcare is not important and must be seen to get all the attention it deserves anywhere in the world. So we know as a country that over the years we have been trying to improve access to quality healthcare, access to affordable healthcare. We have birthed the Health Insurance Act 2017. Some states have domesticated the law as state laws. Some, like Lagos State, has health LASHMA, Health Management Agency.
That's right.
To drive the health insurance, as we know. So personally, I was opportune to be part of the team that wrote the implementation framework of LASHMA way back 2018 when I was still in Lagos.
Okay.
So I was privy to the law and then the takeoff of the agency. And so a few years back, I ran into the PS. Dr. Zamba, and I was asking her, how far, what's going on? How is it going? And she was like, people don't like to pay for health insurance. I'm like, yeah, really? She said, yes, that people prefer to buy Ashwebi, and they believe that
in the social gatherings and all this. Well. Right.
Yes. So I asked her, how much is it to enroll one person on the Ilera Eco program? She said, just 15,000 for an individual per annum. I think 55,000 for a family of 4, and 80,000 for a family of 6. I'm like, that's not bad. So when I also had the opportunity to speak at an event to my former schoolmates, I also shared with them. So basically, there is a large and huge gap, surrounding access to healthcare. Yes, the economy has had its toll on our people, and so that's why somebody like Honorable Bajabi Amila, whose name is synonymous with development,
right,
support for less privileged, vulnerables, empowerment of youth, women, men, and all that. So he's the person, sponsoring this free medical program for 4 days.
Okay.
Across 2 local governments of Koshofe and Ikorodu. And so the Lagos State Health District 2 that oversees Ikorodu and Koshofe are actively involved
in this outreach. Right.
In this outreach, yes.
All right. So, but I hear that,
and also there is a Taiwanese medical mission.
Yeah, that's the question. That's the big question I was just about asking you. That at what point did you guys begin to bring this collaboration with Taiwan? I mean, where is Taiwan coming in here from?
Okay, so I mean, we know that Nigeria is a very friendly international country. You know, Nigeria's foreign policy is a very robust one. Nigeria's doors are open, you know, to international collaborations, partnerships, development, and all the rest of them. You know, so there is a particular Nigerian from Taiwan. She's originally from Taiwan, but married to a Nigerian.
Oh.
You know, she has been married to a Nigerian for over 20 years. You know, and so she, over the years, had been bringing this initiative, you know, inviting the medical mission. So the Taiwanese have this medical mission that goes to different countries every year.
Oh.
And so because she's one of us in Nigeria, you know, she has taken it upon herself to make sure that Nigeria is included as, you know, part of the countries that it will be, you know, coming to. So she reached out to the chief of staff of the president, the President, you know, that, oh, these guys are willing to come and it's like, yes, people need this at this critical time. You know, we know that access to medical care or people's willingness to access medical care as a result of you know, maybe their pockets and lack of proper information, you know. So that is how we have come,
Taiwan has been
at this point. Yes.
All right. Which sounds
so it's an initiative from them.
Right. So which sounds very, very laudable. But what are they bringing? I mean, in terms of this collaboration, so what should residents within these two local governments be expecting to benefit from this medical outreach?
Okay. So an array of services. So we are going to have a mobile dental van, you know, that would carry out oral health checks with dental professionals, dentists, and oral therapists, and orthodontists, you know. So they are going to offer free and wide range of dental care. You know that anywhere in the world, dental care is even more expensive, you know, than basic health care. So we're going to have that free. We are also going to have opticians and ophthalmologists to carry out free eye checks on residents and negotiants. And then we're going to give free eyeglasses to about 3,000 or 4,000 residents.
Wow.
You know, yes, they're going to have free eyeglasses, you know, and then we're going to have screening for tuberculosis. You know, that has been a scourge that has really, yes, we have reduced it over the years, but it's still around. So we're going to have screening for tuberculosis. We are going to have blood pressure check. You know, we had an event sometimes in April in Shomolu local government, and we used a space just next to the Shomolu General Hospital. Mr. Victor, you will not believe that 80% of the beneficiaries of that program were having high blood pressure.
Wow. So that's
80%.
That's why this need for screening is very, very essential.
Very important. And a lot of them didn't even know they had high blood pressure. You know, so a lot of them are first time, they are getting informed for the first time.
For the first time beneficiaries.
They were not part of those. Yes, you know, they're first time, victims. They didn't know that they had high blood pressure, and so the team had to counsel them and refer them, to the hospital for further checks and all the rest of them.
Okay.
And then they're going to have HIV counseling and testing.
All right.
They're going to have treatment of minor ailments and free medication. And also the Taiwan mission have also pledged that some people that have maybe small surgeries, would also enjoy free medical
follow-up
overseas treatment in Taiwan.
Oh.
Yes, they are going to offer that. Yes, some of the people that are beneficiaries would also enjoy free surgical, international one in Taiwan, depending on the type of condition
that they have,
and treatment,
all right,
that they have. Yes,
all right.
They have also put that on the line.
So the big question here is this the first time that we're having this kind of outreach?
No. I mean, so annually, over the past 10 years, Honorable Bajabi Amila usually organizes free medical outreach. However, we used to have them basically in Surulere local government, Itire Kate, and Ijesha.
Okay.
Kokaguda. So we used to have them in our domain in Surulere local government. So this is the first time that we are taking the free medical to other local governments. Because we are going to have our own in Surulere next month in November.
Right.
So when this came around, the chief of staff to the president was, in his wisdom, magnanimous to say, okay, since we're having our regular annual medical outreach in November, let us take this to other
local governments,
for other parts of Lagos to enjoy this, and spread, the goodwill across the state.
All right, so let's look at this local government again. You said it's going to happen where and where?
Okay, so we happening in Koshofe and Ikorodu. You agree that these are very high populated areas in Lagos. So the first day, which is Monday, will be at Agboyoriomi. We have an island called Agboyoriomi. Yes, in Agboiketu. So we are taking it to the doorsteps of the occupants of the island, who are mostly fishermen and women, who are mostly very low income earners and vulnerables, and people that would really access the services and enjoy them.
Right.
And then the day two, which is
7th on Tuesday.
Like I said, it's 6th of October.
Okay.
Day 2, which is 7th of October, will be at K2 Mascara Primary Health Center. That's Agboyorile, which is on the land.
All right.
So yes, so the primary health center there is going to host us, and then the residents and constituents will be able to move in freely and enjoy those services. And then day 3 and day 4 are both for Ikorodu residents and constituents.
Okay.
So we have chosen a central place in Ikorodu, which is Itailewa Open Field. You agree with me that Ikorodu has a lot of suburbs within itself.
Very true.
So we chose somewhere that can be easily accessible, to all parts of the suburbs in Ikorodu, which is the Itailewa Open Field. So we will have a 2-day outreach there on 8th and 9th, which is Wednesday and Thursday.
All right.
By the grace of God.
And which time of the day? Which time of the day can people come to those locations?
Yes. So we are starting every day by 9 a.m.
Okay.
We are starting every day by 9 a.m. Yes.
All right. And once they get there, they will be able to access all of this. And you said it's a free,
there will be.
It's a free medical outreach. You said
completely free, 100% free, zero cost to everybody coming.
All right.
Zero cost.
All right. So, some will be wondering as well, now that we're having it in Koshofe, we're having it in Ikorodu, what about other localities? Even though you said you guys are reaching out for the first time to other local governments, and those that are listening to us right now, some will be wondering, when is it going to extend to their own locality?
Yes. So everybody wants something good, so we will give the feedback, when we finish this one, to the chief of staff of the president, who is a proud Lagosian and a proud Nigerian and a very benevolent man. You see his legacies across education. Somebody that has facilitated modern hostels in Unilag, facilitated buildings in Yabatech, in LASU, in Federal College of Education in Lagos, facilitated health facility in Surulere, ultra-modern hospital, so it's somebody that is very passionate, about human capital development, who has also empowered people. So I'm sure that once we have such windows of medical outreaches for other local governments, we would be happy and willing to, lend a hand of support as well.
All right. So
I don't have any doubt. Whatsoever.
All right, I will talk much more about this collaboration between the Health District 2 and, of course, the Taiwanese medical outreach. But there's a message here that just popped in for you. It says, good morning, Victor and Honorable Lawal. This is a very good initiative, but will people need to bring ID cards or voters cards before they can benefit? Juwon from Ikorodu is sending this one in. Juwon, thank you so much. Well, I guess, Honorable Lukman, you need to respond to that.
Well, I don't think it's a bad idea to have a valid ID, whether it is NIN or voter's card. But I mean, that would not be a criteria for access. We can also use the opportunity to sensitize our people to register for their voter cards. It's in line, but it's not a prerequisite for anybody to access the social services. It is coming from the benevolence of the Chief of the President and the Bufem Bajabi Amila, with nothing attached. Nothing attached.
So let's talk about this partnership now. So the Health District 2, they are bringing in personnel. They're bringing in, what are they bringing in collaboration with this Taiwanese outreach?
Yes. So the Health District 2 have the mandate to oversee primary health centers, across those local governments, like as I mentioned.
Okay.
Their mandate, specifically includes improving access to health care, ensuring that preventive care, is carried out. Because if preventive care is improved upon, we'll have less crowd at the secondary health facilities, especially general hospitals. So we should, as a country and as a government, improve primary health care, and preventive care generally. So they jumped at, the initiative immediately. We reached out to them, because it is going to help in improving the health indices, that they are managing and trying to improve. So yes, they are going to help us with medical personnel, in addition to the Taiwanese team, in doctors, in ophthalmologists, in opticians, and in dentists, and oral healthcare specialists, nurses, pharmacists and pharmacy attendants, medical health records people, and all that. So yes, they are one of the principal partners, in this outreach. And the permanent secretary, Lagos Health District 2, Dr. Diolajide, has been very, very cooperative in ensuring that we have a seamless and well planned out event.
All right. Another message just popped in. It says, "Sir, will these outreaches be one-off events or continuous efforts so that other health districts can also benefit?" Akim is sending this one in. Akim, thank you so much for your contribution.
Yeah. So it's I mean, like I said, that the person and personality of Honorable Femi Bajabi Amila, would stop at nothing to extend this kind of outreach to other parts of Lagos. So we will give him all these feedbacks, to convey the request,
right,
commendation of legislation, that it be extended to other parts of Lagos.
So let's look at the figures now. So what are you guys looking at? Yeah, so in terms of attending to people and improving access to quality healthcare, what are the figures that we're looking at for these two local governments that you want to attend to?
Okay, so within each location, for instance, in Koshofe, we have Agboyoriomi. Not less than 2,000 beneficiaries are being targeted at Agboyoriomi.
Okay.
Being an island, and then Agboyorile, which is at the Mascara Primary Health Center on day 2, we will be targeting close to 5,000 beneficiaries.
All right.
And then Ikorodu, how Ikorodu is a largely populated area. Yes.
Densely populated, indeed.
So I think, yes, so we are looking at 5,000, for Ikorodu.
Okay.
On both days.
So in total, we should be looking within the realms of 12 to 15,000 beneficiaries for these 4 days.
Yes, not less than 10,000 beneficiaries.
Okay.
Not less than 10,000 beneficiaries.
All right. Lagos Traffic Radio, 96.1 FM. Another message here says, good morning, kudos. This is a welcome development for those of us living within Ikorodu. Sir, please, when mental health... Okay, sir, please, will mental health be included in these outreaches? Many Nigerians are struggling silently. Thank you. Omoyele is sending this one in from Itaoluwu. All right, Omoyele, thank you. That's Itaoluwu, rather. Thank you so much, Omoyele.
Itaoluwu, yeah.
So what's your response to that?
So, yes, mental health is not...
It's not included in this particular one.
It's not included in this particular one, yes. But I agree with that person that that is an area that is really requiring more attention from healthcare providers generally, whether in the private sector or in the public sector. And I think it will be a good one to look at in the nearest future.
All right. We're hoping that something will be cropping up very, very soon that will be dedicated to mental health. But let's begin to round up all this, everything now that relates to this conversation, Honorable Lukman Lawal. So let's look at the dates again. You said from Monday through Thursday?
Yes, from Monday, 6th October, at Agboyoriomi in Koshofe local government. Tuesday, 7th October will be at Mascara Primary Health Center in K2, which is also part of Koshofe local government. Wednesday and Thursday will be at Itailewa Open Field in Ikorodu, which is a central place for all the Ikorodu suburbs.
All right, then. We'll leave it at that for now. Honorable Lukman Lawal, what's your parting thoughts as we round up the program?
Yes, so I'm happy to catch up with Lagos. That's my route. That's my base. Even though we've been away for a while, or once in a while. So I'm happy that we are bringing something good back to our people. I want to enjoin Lagosians to come out en masse to access the free healthcare provided by Honorable Femi Gbajabiamila, Chief of Staff to the President, a proud Lagosian. Thank you very much for this wonderful opportunity.
All right. It's nice connecting with you. Thank you so much for linking up with us this morning.
Thank you, sir.
Okay, then. So I've been speaking with Honorable Lukman Lawal, who is the Special Advisor to the Honorable Speaker, House of Representatives on finance and budget matters. A brief break. When we return, we do our birthdays before we switch gears to the next level.